Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster with Startup Health, and I'm here today with Javier Cardona, co-founder and CEO of Trace. Javier, thank you so much for taking time to join me for a quick conversation this morning.
Hi, Logan. Thanks for having me.
You're calling from, I know you're from Colombia. Is that where you are now?
Yes, I'm in Bogota, Colombia.
You're in Bogota, okay. So I was excited to talk to you today because Trace is really honing in on this issue of opening up access to care. And I've heard you talk before about what a huge issue access has been, not just in Colombia, but in Latin America and in the much of the Spanish-speaking world. So I want to get into that. I know you're attacking access to care through a telemedicine platform. Never has there been a more important time for telemedicine than in the middle of the coronavirus. So excited to talk about that as well. I was wondering if you could start by kind of placing this in context in terms of the access problem in Colombia, in Latin America, in the markets where you work.
Well, sure. Well, the problem that we have in the region is tough. You know, it will take you from a day to a week to just talk to a doctor. And that was in normal conditions. So what is happening now in the last 2.5 months, it's even worse because we had an access problem, but now hospitals are closed and clinics because they have to tackle the COVID-19. So people are even having more problems to access healthcare. And it's been really a crisis. Not only because of the whole pandemic situation, but because it has worsened from what it was 3 or 4 months ago.
Yeah. Do you get a sense of what the true health costs are from that lack of access? Do you track any of those numbers?
Yes, I mean, well, we are emerging economies, and the cost for a person to go to a doctor, I mean, it will take you 1 day. On logistics, transportation, but also you will lose 1 day of work. So 1 day of payment. So the impact is huge in relation to the economy. I mean, so it could be $20 or $30, but that's a lot of money in these countries. So what we're doing is trying to solve that problem. The whole situation is having us exploding because of COVID-19. We're doing 7 times the number of consultations we were doing 2.5 months ago.
Wow.
And that's, well, that's great for us. It's great for a lot of people that now have access. And also it's great for the whole telemedicine landscape because now it's becoming not only popular, but a need. It's something that is going to be here to stay.
Okay. Talk me through the platform itself. How do people access care through Trace?
Well, for us, access is not only about having you connected to a doctor. So what we've done is we enable technology to do the process smoothly. So basically our platform has an AI-assisted component that helps you symptom assess yourself, and is also optimizing doctor's time. Because the problem here is that also we don't have enough doctors.
Okay.
So by using our symptom assessment, platform can triage and pre-diagnose your condition, so the doctor will use less time to do your consultation. So that's in the core of the platform. And accessing the platform is really easy just by our website or downloading our mobile apps. We're now, last May that just finished, we served 300,000 people in Latin America. That's a lot of people.
Over what time period? 300,000?
1 month.
In 1 month, okay.
1 month. So 300,000 consultations in 1 month, mainly in countries like Colombia, Mexico, Peru, Chile.
That's across your entire network?
Yes.
Various countries. Where does that place you in terms of the telemedicine landscape in Latin America, in terms of the number of consults? Does it make you one of the larger providers?
Sure. Well, pre-COVID, telemedicine could be less than 1% of the number of consultations, right? By far, Trace is the largest telemedicine provider in the region.
Okay.
300,000 consultations. It's a huge number, and it continues to grow. We expect this June that could be around 50% more of that. And also because we've been able to partner with payers. So we have insurance companies paying for the consultations. Actually, 2 weeks ago, Inter-American Development Bank uh, approved financing for doctors to provide 100,000 consultations in the city of Bogota. So COVID-related consultations paid by the Inter-American Development Bank. So because of the access problem
Wow.
is huge, and we have the capacity to scale and to do this in large numbers.
Is that the business model, going after these payers to make it as cheap as possible for actual patients? Or is
Yeah,
it?
well, yeah, that is correct. I mean, we work with insurance companies because they're the ones who pay the most. We have also a B2C product where some people pay out of pocket. So they pay on demand for the consultations, or they're subscribed to our services. But 3 months ago, just before COVID, we launched Undoctres businesses. So we offer Undoctres as a benefit to employees, and that's growing like crazy because, you know, maybe you are a corporate or a business that you're not able to afford health insurance, but you can afford our product, so you keep your workforce safe and with healthcare. So that's one of the services that is exploding the most.
How does, you said that's a big cost savings. How would you compare, like if you were making that pitch, how helpful is that financially to a company to offer this instead? Or what kind of savings are we talking about?
Yeah, well, that is a great question. We work with insurance companies for quite some time already, and we have built some numbers where people that use the telemedicine product use 11% less physical resources or assets. So what I'm saying is that 11% saving on physical consultations is a lot of money because of the logistics, the doctors, the whole thing. So that's the impact that we've seen with insurance companies. They're very happy with us. We have like extended contracts with many of them, and we're onboarding more insurance companies. And on the corporate side, on the Undoctres business product, we're seeing a lot of impact on reducing absenteeism pre-COVID, because people now don't have to skip work for 1 or 2 days. They could just talk to the doctor on the phone. So that's still being measured, but the impact they're having is at least they can see their workforce is safe now and with great access. And if you need additional care, the doctor will tell you and will guide you. So there's a lot of time saved on doing the whole process in a more effective way.
Just to clarify the platform itself, you've got the AI-driven sort of chatbot. Initially, you can do a symptom check and it'll pre-triage you, is what I'm understanding. And then there's also a chat with a physician component, right? Is that text? Is that video? How does that work?
Sure, exactly. So users or patients basically use us through our website or mobile apps, right? So the first thing they do is they type in what is the consultation about. Then the AI component initiates the symptom assessment. They get triaged and pre-diagnosed before they connect to the doctor. So when the doctor starts the conversation, want to start like, what do you have for how long? That information is already provided by the platform. So the doctor is actually saving time on that part. And that's how we are enabling more people to use our product, because we're doing it in a more optimal way. And on the user side, you will get a better medical outcome because the doctor now have more and better information about what are you consulting. So the first thing you will initiate by text. If you need a prescription, the doctor will initiate video so that we comply with the law. And that's how it works. But we keep it text-based for the majority of our consultations.
Okay.
Because it's not only about the price or the access, but also in the region, the quality of the connectivity is still an issue for many people. So like be able to have this video conversation as we're doing now is not the possibility for the most of the people. So text-based is also allowing us to do this product for masses.
Interesting. Just shifting gears slightly, You're a CEO of a company, you're thinking about company growth, and you're in a unique situation where while so many companies are struggling because of the of COVID-19, you said you've had 7x interest, 7x calls over the last month or two. And so you're seeing this explosive growth. Obviously, as a small company, that's good for adoption, but I'm sure that has also come with incredible challenges. So I wonder if you could just speak to some of the challenges of rapid growth during the coronavirus.
Well, first, I would like to say that I'm very proud of how we responded, how the platform responded to this growth. Uh, the challenges are, of course, from the technical part to be able to serve more people without decreasing the quality, because that's very important for us. Challenges also comes on how can we provide a standard experience and a standardized experience for most of our users. So recruiting more doctors, we now have over 500 doctors on our network that are actively daily doing consultations. So that's been a challenge. The other challenge has been that the problem is not only in Colombia or in Mexico, which are probably the largest Spanish-speaking countries, but also in some other countries. So we're being called to go and work even with governments in Ecuador or with large companies in Peru. So we've been onboarding doctors at a very fast rate in those other countries. So that's been a challenge. But what I would say is everything is worth it. Everything is worth it. Probably 2 or 3 hours of sleep by the entire team is worth it, because now we have a company that is 7 times bigger, not only in consultations, but also in revenues, and that is looking to a bigger opportunity, and the adoption is different now. So the whole challenges of growth or keeping the platform available, on the accuracy, on the AI, I could go over and over with many challenges that we have, but I think we focus on providing a great experience, and that's our primary goal right now. And the other thing can wait. Probably we're not doing many more new features at this point. We're just prioritizing to keep providing a great service. And well, that's been the journey, and many challenges still to come, but an opportunity that looks more clear because of the adoption. And now I think, as I said, telemedicine is here to stay. And in emerging markets, I think it's even more clear now.
Mm. When you say even more clear, I mean, that sort of triggers for me this idea of leapfrogging technology, where a market can look at the rest of the world, avoid the mistakes that they made, and jump forward at a especially rapid pace. Do you see that happening in Latin America?
Yes, and because telemedicine also has been a lot about regulation.
Mm.
And we've seen, because of COVID-19, is a shift in regulation. Now, pretty much all governments in the region have allowed telemedicine. Okay, no problem with that. We're going to be flexible with the security, with the HIPAA kind of stuff. We're going to be flexible about the prescriptions, and it's working. That's it. That's how the system is being able to cope with so many challenges in demand. So with having the regulation part solved, because now it's proven that it's working, that's why I see, not only from the technology part, but regulatory part, payers part, and adoption from users. That's happening already and has happened in the last 8 weeks. That's what I see that is going to stay, and we can avoid a lot of mistakes and a lot of doubts, and it's normal. It's healthcare. No? It's not easy, but now it's like if we had a pilot and it worked well. That's what happened with COVID-19, with telemedicine, at least in emerging markets. And well, we're exploding, and we're looking forward for more explosion on that.
Javier, what keeps you going? What inspires you? Obviously, you've got all these challenges that are technical, teams to manage, but at the end of the day, telemedicine, access to healthcare is about real people getting the care that they need. People who could literally die without getting faster care. So, on the personal side, what inspires you when you're only getting 2 to 3 hours of sleep?
Well, as you said, our patients, our users, because every time we're able to solve a problem for them, every time we can avoid visit to a place where they can get the virus or something like that, or every time we can save them real money for people that really need it, a day of pay. That's what's keeping us going. That's why actually we're building technology. So the technology we're building, Undoctres is not about connecting you with a doctor. That's easy. Undoctres is about how you make the process smooth, how you put technology to work for the user and for the doctor, so we can serve more people. That's our goal. And our vision is to become the healthcare gateway in the region, so that the process is efficient. So you need something, you just grab your phone and you do what to do next within 1 or 2 minutes. And when you see people writing to Undoctres, thanking us, well, that's great. That's keeping us going, our users, and put the technology to help them and to help us serve more people. That's what motivates me.
That's awesome, Javier. I think that's about the time that we have. If someone wants to partner with you or learn more, obviously they can go to startuphealth.com, where we have written about you on our company profile. But how else can they reach you?
Well, my email is jcardona at 1doc3.com, or going to undoctres.com, and we'll take it from there. I'm sure people will find how to contact us.
Awesome. Javier, thank you for taking the time to talk to me. Really inspired by the work that you're doing. I think it's going to make a huge impact in the whole region. So thank you.
Thank you, Logan.